Okay, so Dr. Malone, we're in July 2nd, and here we are in the middle of a crisis in Florida and in our community. Most people don't realize it yet, I don't think, but today Florida had 10,000 positive coronavirus cases. That's a milestone for this state in one day. Yesterday we were down to 2 or 3 ICU beds. I think that number has gone up, you just told me, to 5 or 6 or 7.
I think
ICU
seven.
7 in the county. So there's 7 ICU beds in Escambia County that are available. The concern, obviously, that we talked about yesterday is we're just now getting the increase in positive cases. There's usually a 2-week lag time between positive test and hospitalization. And then there's a week or so lag time between hospitalization and ICU, or 5 days. And so you're really not going to feel the surge on the ICUs until 2 weeks from now or so. Is that accurate?
Yeah, I guess most of the studies show that if someone's going to decompensate, it's going to be during that second week of their illness. And those are the people that do end up in the ICU. So these could have been people that had a positive test and they were part of the data 5 days ago. And then, over the course of the weekend, they're, presenting to the ICU. They thought they could ride this out at home and they're not.
So here, the reason I'm doing, we're a personal injury firm. We do medical malpractice cases. We do car wrecks, boat collisions, jet ski accidents, all kinds of accidents. This is really not what we do, right? The reason I'm doing this is I feel like the government officials, state level, a lot, really, federal level for sure, state level, local, some of them they're spotty. Okay. Most of them don't know what's going on or don't want to talk about it. I feel like they need to hear from a physician who's interpreting this data for them so that they can get some real helpful information, because you're not going to get it from a politician. The politicians are not going to give you accurate information because they have a slant. They don't want to get a mean call from a business lobbyist if they tell you that something that keeps people from spending money, or they don't want to say something that's overly negative about the potential for healthcare crisis, because then they'll get calls from the healthcare lobbyists or the healthcare representatives. The purpose of this thing that we're doing during this virus time, instead of us getting on here talking about the personal injury work that we do every day, day in and day out, what we did today, day in and all day, I don't think that's pressing right now. I think what's pressing right now is this issue. And I feel like what I can offer the local community here, and what you can offer them more directly, is a local physician's take on what all these numbers mean, and then what people can do to protect themselves and their families moving forward. You and I have been very, matter of fact on occasion about this. We've been certainly not been alarmist in any way, I don't feel. I feel like now, and you can correct me, but I feel like now we should be alarmist. I feel like now somebody should be blowing a whistle and saying, okay, folks, I know that we've been sort of watching this happen on the news and other places. Now it's happening here. Am I wrong?
No, you're not wrong. And I think now's the time to be more concerned about you or your loved ones getting it. If you're active in the community at all, if you're out running your errands, if you're trying to work from home or anything, this is when it's going to happen. That's what's showing up now. All this stuff that we talked about back in March, we said, oh, well, all the young, healthy people are good, and it's not a concern. It's the complete opposite now. So I think this is the time to be concerned.
All right. Go ahead.
The other thing is, back in March and April when we said, okay, here's the problem. The problem is all the long-term care facilities. So what was the fix there? Let's test everybody at the long-term care facilities. That's mandated. And you could. You had people that really didn't have a choice, the employees as well as the residents. And now the only people that are testing positive are the people that are being proactive and going on their own. And I think, for every positive case out there, there's got to be a handful of positive cases that we're not capturing the data on. So if you think these numbers look bad, it's probably much higher than that overall.
All right. So what people say over and over again, and I think it bears us to repeat, because we keep saying it over and over again too. And I think since I keep hearing it, I think we should keep saying it. But some people say, oh, well, the numbers of cases have gone up because we're testing more people. So let me be clear. I agree with you that when you test more people, the number of positive cases goes up. Yes, that is an accurate statement. However, you shouldn't look at that. You should look at the percent positive, which is using the same method of comparison to whether you have 10 tests or 10,000 tests. The percent people that are testing, how many of those people that are testing positive? That's the figure that you look at. And today's was the highest I've ever seen it in Escambia County. Correct me if I'm wrong. It was 19.4, I believe, was the figure we got this morning when it got released. So that means almost 20%, 2 out of every 10 people that are tested, 20% are positive. Folks, it was below 1% here until a couple of weeks ago. Now it's close to 20% positive. That has nothing to do with the number of tests. You understand? That's an infection rate. That means the virus is more prominent, not the people getting tested. So the growth of the virus is measured by the percent positive. That's what you should pay attention to. And that's why you should be wearing a mask and physical distancing. I'm not saying shut everything down. And that's another thing you need to hear. When you hear people talking about how bad things are, that is not the same thing as saying they want everything shut down. So stop thinking that way. When people are saying that things are bad, they're not saying shut down. People are saying things are bad. We need to make them less bad. How do you make things less bad, Dr. Malone? How do you make things less bad in this scenario?
Well, it's everything you've been hearing, the masks, the hand sanitizer, I guess being obsessive about wiping surfaces and handles and railings and things like that are more used by more than one person or your immediate family. That's, I think, how you keep yourself safe in your own milieu, but then it's out in the public sphere, how do you keep safe? And it's really just, asking yourself an extra time whether or not you need to take that trip or whether you need to, go to that errand, take that trip to the store, get an errand accomplished. And, see, is there another way to do it, a smarter way? Or can someone do this for me if I'm, if I'm going to be more ill than them if I were to get this virus? So just trying to I guess, streamline your life a little bit.
All right. So the testing centers are at capacity. I think there's more testing facilities that are now open. I heard today there's some others in town that are now open. What do you know about that?
Yeah, they're available. So, and I guess I'll give another plug to that Florida COVID Action website. They have a pretty good, and I'll share it here real quick. They have a really good graphic on there that shows locally where you can get tested. So once we get charged through this, but anyhow, it's more than just, the hospital-based ones now. Now you can call and get an appointment at CVS. There's a couple locations in town, and you'll, drive up in your car and get tested. There's some that are popping up in some of the local business parking lots. And so you'd want to pay attention to where those are at. I think there's one up by Publix on 9th. So let's see what this shows here. All right, so this is that Florida COVID Action website. So I'll show you the hospital thing real quick, which we looked at yesterday. So there's your 7 ICU beds there on the left that have, I guess, opened up a little bit. And I did do some research so I get a little more accurate count. There's 118 ICU beds that are listed inside the county. Right. So of the 118, there's 7 available. It means there's 100 people in the ICUs here, people.
And there's no way for us to know. There's no way for us to know what percentage of those ICU beds are COVID patients. Is that right?
Correct. Other than to know that hospitalizations over time we've only had 100 people admitted to the hospital since this all started. And that goes back to March. So that there's not 100 people still admitted from March. Either they got better and they've been discharged, or they didn't get better and they died. So I think that the number's not 100, but
All right.
it's still significant. Anyhow, so the Get Tested tab on here, this is a fantastic resource. It's like going on Google and searching for a hotel or a restaurant. It shows up as a map. You click on the little green dot, tells you on the left-hand side over here what kind of testing they're doing, how to get a hold of them. So this is a pretty good resource.
This is that woman's website that used to work for the state of Florida. They got fired because she was trying to tell the truth, right?
Yep. This is her site, and so this is a good resource for people to know, what the options are to get tested. And so, like the bottom two here on the left show the CVS locations, and they're testing for the PCR, which is for the virus, but then it shows the ones that you can get tested for the antibody and all that. So it's something that I would recommend checking out if you have a need to be tested, or if one of your loved ones does.
Okay, very good. Now, Dr. Malone, we also pulled a couple of journal articles today. I saw one doctor from NYU Medical School talking about, she's a forensic pathologist or a pathologist, and they had done some autopsies on, I don't know, seemed like 10 or less COVID patients that had passed away. And they had some interesting information, I guess, from a medical perspective about what these patients seem to consistently have as far as the findings were concerned on autopsy. Was any of, we've talked about the cytokine storm that happens in response to the virus, and we've talked about how really it's that storm that really tasks the system and really is the thing that the body's trying to fight off, and that the health professionals are trying to tamp down. But what did this autopsy, is that study, was it consistent with the discussion we've had in previous videos about how that cytokine storm is really what we're fighting against here?
Yes and no. So the study on the autopsy, they can't see the cytokine storm, but they can see the sequelae of it. And so what this showed actually was that basically it's a clotting cascade that gets set off, and that's tied into that cytokine storm. So besides causing a bunch of inflammation and ARDS, that respiratory distress syndrome, and basically making it so that you're effectively drowning. That's why they have to try to ventilate you. Apart from that, or in addition to that rather, there's clots. And Joe and I are intimately aware of clots and how they can be destructive and fatal. And so they found major large clots in big vessels. And so the pulmonary arteries, inside the chambers of the heart, inside some of the other great vessels of the body, there's these large clots that they're finding. And these are autopsies that were done, back a couple months ago, and she finally got around to publishing it. Well, then she's got some other autopsies that she has done since this initial set of autopsies that have shown that the large clot burden is not there as much. And then she's doing some research and tying it back to patients who are being systemically anticoagulated with part of their treatment. So back in March when you got admitted, you weren't getting started on heparin drip, for instance. You were getting treated with everything else besides that, with the exception of that. Now that's part of the armamentarium to anticoagulate these people and to try to thin their blood. Because the scary thing is they're ending up with these large clots, and Joe and I, again, know this. Where do these large clots come from? They usually come from the legs. You hear about DVTs, and that's the stuff that everybody understands when you're going on a long trip, a flight, get up, move around, move your legs. Well, guess what? These people that they found in the autopsy in this study, they had large clots in their major organs, but you know where they didn't have them? In their legs. That's scary to know that you can get a large clot like that and it didn't start in the leg. And that's the effect of the virus on the body and the clotting cascade.
Like the doctors are learning this stuff in real time. It's like usually you have years and years and years to study something. Now they're having to, God bless them, they're having to get all this information in and try to get helpful data out to all the treating physicians, right? Yep. So at the end of the day, they're going to probably start using this as standard of care as far as the anticoagulant therapy sort of earlier on in the process of treating the COVID patients. Is that pretty much what this comes down to?
Yeah, so long as you don't have a contraindication to be heparinized or anticoagulated, which, you know, your doctors or the ER they would be required to ask you that, besides just dumping medication into you. But if you don't have and it's not treating the virus, it's treating the virus's effect on your body.
All right.
So
We have done this in the past, but I want to make sure we do it again because it's an important thing. There are studies, multiple studies, I believe, that tell you how much reduction there is if there's one mask on and you're in a conversation with another person and they either have one on or they don't. If I'm remembering correctly, if you have one mask on and the other person has a mask on, the percentage chance of there being some transmission is in the single digits, if I'm remembering correctly.
Yeah, on the studies they did, it was cutting it down more than 75% when it was a two-way interaction with masks. But when you have one mask, it was between 25 and 50% reduction.
Right. So if you're one of those people that says this is crazy and I don't want to shut down the system, I don't want to shut down anything either. Trust me, I make less money. So as everybody else does. So here's the deal. If we want to get from this point to the point where we're back to some form of normalcy, which will be when we have a vaccine, in order to get through that without having a complete shutdown again, which we'll have to do if things keep going the course they're going, because the hospitals will be overrun. And if the hospitals are overrun and you got people standing in the parking lot dying, there's not going to be a lot of people looking for burgers, right? So in order to prevent that kind of thing from happening, we need to be smart at this point. We need to moderate the growth of the virus, okay? The only way that happens is the hand washing, mask, and physical distance. That's what we need to do, regardless of what your politics are and regardless of who you believe on TV. Science tells us this is what needs to happen. And if you don't do it, we're going to end up in a worse situation. So, Am I wrong?
No, you're not. And you mentioned the vaccine, and if you'll allow me to share, I guess, a little bit of good news that we came about today was Pfizer's trial on their vaccine. It's a phase 1, phase 2 trial, and we'll link this here today. But basically, the intention of the vaccine is to stimulate the body to make an antibody. So we've been hearing about all these antibody tests. Do I have the antibody? Is it going to help me out? So when we get flu vaccines every year, we stimulate an antibody for that flu. Well, this vaccine in particular, depending on how they administered it, because they do it a couple of different ways as they're testing it out, it stimulated the growth of the antibody in basically every subject, and it stimulated it to like 2 or 3 times the degree that a normal infection would cause. So if I got infected with COVID, my antibody level would be at level 1. Great, I'm immune. Well, if you got the vaccine and you're in this trial, they're saying that your antibody level is going to go 2 or 3 times as high as my antibody level. So that's good news there. It works. They have a bunch of other steps to get through as far as safety and practicality and getting it out to the masses. So this is just one bit of good news, though.
So if somebody hears you say that, though, let me be clear. And they think, okay, well, there's going to be a vaccine. So what am I worried about? I don't need to wear a mask tonight. There's going to be a vaccine. If I get it, I can get the vaccine when it comes out. Why is that not good logic?
It's logic, but it's not good logic. I agree. And it's because this is in a trial and they had, 30 subjects in it, 30 individuals. You're talking about needing to roll something out to over 300 million individuals.
That's just in this country.
Yeah, just in this country. Yeah, and I will say that this one vaccine, it's actually a 2 injection. One of the protocols was 2 injections. So you're talking about having to duplicate resources and services to get adequate vaccine if they go with that option, if they can't think of a single injection option.
So here's the timetable.
It's
if it comes out, let's say it gets approved in January, which would be ambitious. Let's say that happens. You still got 6 to 8 months of distribution time. So,
yep.
And then at 1 year from now, before you actually get the vaccine. So if you think you're going to ride this out without a mask until next July, you're part of the problem. So
the vaccine is about a 14 to 21 day stimulus to your body. So you get an injection in your arm muscle. Guess what? You're not immune. You're maybe immune a month later.
Right.
So add a month to it.
Add another month to it. Okay.
Yeah.
This time in August next year. Okay. All right. Are there any other tips that you want to tell people? I know that fireworks were canceled, I believe, everywhere, which is the smartest thing that they've done in a while. I'm surprised it took them this long to do that. Blue Angel got canceled. I saw right before I came down here. I'm upset about that because I enjoy that so much, but it was the right thing to do. What else? The beaches aren't closed yet here. So what we talked about last time, the beaches were open and we thought they should be closed, which is again how they should be closed, and not because people necessarily congregate at the beach. I think the problem is they all park next to each other and then they congregate to get to the beach. I think that is a problem. So if you can't control that, which it's hard to control, then you got to shut it down. And that's why I feel like it should be shut down. As much as I don't want the beach shut down on July 4th, I think it should be. I think it's the safest thing. I think people should be staying put in their house. The other thing you got to think about is if you leave your house and go to the beach, the chances you're going to stop somewhere else are greatly increased, which means you're going to probably interact with somebody else on the way to the beach or on the way back from the beach. You're going to want to stop and get gas or get something to drink or go in a store and grab something for the beach, and that increases the likelihood you're going to come in contact with somebody else. And so that's a problem too. And I wish there was an easy solution to it, but there's not. I mean, Crab Island I don't know what they're doing at Crab Island this weekend. It should be shut down. Fort McRae should be shut down. But I hadn't heard anything about that, to be honest with you. I know the feds will police that fairly well, but in any event, if you end up in one of those places and you don't have a mask on, you're probably going to get the virus. I mean, or you got a pretty good chance of doing it, especially if somebody in your group is around a 20-something-year-old person, because the 20-something-year-old people are carrying this virus around right now in large percentages. I can just tell you that based on my office alone. I mean, because we have 15 or so employees, 20 employees, and there's probably 4 that are 20-something. Well, 2 of those 4, 50%, have had direct contact with somebody that had the virus and have actually made us all get tested. Okay? One of them tested positive for the virus. The other one, her roommate tested positive for the virus, and she was a carrier. So both of them have been, obviously were sent home before the diagnosis, but they've been at home. We've all been tested and fortunately tested negative. Anybody in that age group, I basically said, look, I don't want to be biased by your age, but guess what? You got a roommate. You can't control where they go. Of course, they're all going out to the bars and restaurants, and that was dumb to open those up, and they're back now at home. Look, if we're going to do this smartly so that everybody can eventually open up fully, we got to be masked, right? And we got to be using hygiene with our hand washing, and we got to creating some physical distance. If you do all 3 of those things, the percentage chance of you catching the virus goes way down almost to 0. And then we can do whatever we want. You can spend money wherever you want. Every business can be open and it can all be great. But until we get to that point, we're risking a lot. Okay? Life and death issues here. So if you have any questions about this, you can find us on the web at zarzaurlaw.com. We'll be back tomorrow with another video. Hopefully we'll have some better news, but I have a feeling that given the trajectory of our community here, we're going to have worse news tomorrow. So we will see you then. If you have any questions, you can find us on the web at zarzaurlaw.com, info@zarzaurlaw if you want to email us, or you can comment under the video here. We're going to put links to the journal articles. Thank you, Dr. Malone. We'll see y'all tomorrow.
Yep.
Take care.
All right. Bye now.
Mask up.